Good evening, and welcome to this special edition of Doctors on Call on the COVID-19 epidemic. I'm Dr. Paula Termuhlen, the Regional Campus Dean at the University of Minnesota Medical School Duluth Campus, and I am your host again tonight for our program. We're continuing this series of special programs to answer viewer questions about the coronavirus, and I want to thank all of you for sending questions in tonight. This week, we're putting on a special focus on mental health as we all struggle with the stress of the unknown and uncertainty that the pandemic has brought into our lives. So for those of you who've provided us questions that aren't on that topic, stay tuned. We'll get to them, but probably not this week. The telephone numbers and email address for your questions can be found at the bottom of your screen. Our panelists this evening are Dr. Carolyn Phelps, a licensed psychologist with DreamLife Psychological Services, Dr. Paul Sanford, an internal medicine specialist with St. Luke's Internal Medicine Associates, and Dr. Steve Sutherland, a psychiatrist with Essentia Health in Duluth. Members of the WDSC staff are standing by to take your calls and emails, and I want to reassure everyone that we are practicing good social distancing here on the set, as they've taken very good care of us, and now you can see where we're all sitting pretty far apart from each other. Let's begin now with questions about COVID-19 and the mental health challenges associated with the pandemic. So, Dr. Phelps, tell us a little bit about what you're seeing in your office right now.
Well, everybody who comes into the office or who I'm seeing via telehealth, we're all talking about the COVID-19 and how that's affecting them. Some people with increases in anxiety and increases in depression. And I think a really important factor to think about is that we all come to this moment in the pandemic with whatever stress that we were carrying up to that moment when it hit. And then the pandemic itself is going to affect each of us in different ways. Some people in very gross ways, big ways that are and can be devastating to them, but everyone is being affected. We're all in a new reality and kind of living in upside down land right now.
Yeah. Dr. Sanford, how about you? What are you seeing in your office?
Well, we're still seeing our people with their diabetes, their heart failure, their non-infectious disease problems. We're trying to have people who have fever and cough, runny nose, go through the fever and cough clinic, which is attached to the emergency room. But still people get their diabetic problems, their heart problems. Seeing young and old, and people are just coping.
How about you, Dr. Sutherland?
Seeing a few different things. For one thing, you may, as many people may know, there's about 20% of the population in any given year struggles with a mental health condition. And we're seeing an interesting trend, which is that sometimes some people that came into this pandemic healthy, and then people in the milder symptom range seem to be struggling more in some ways than the people with the more severe illnesses, whose lives are maybe more used to being turned upside down, and they have learned to adapt to that. So I would say maybe the most striking thing of all is both that, and also that even more than, say, an increase in anxiety and depression and irritability, which there's been some, it's an increase in disorientation. People are just, they are turned upside down and that disorientation feeling is the most prominent finding, if you will, of all, I think.
You know, I can really relate to that. I'm feeling very disoriented myself. I was talking with my office staff in the general surgery clinic, and we were all just sort of like looking at each other like, we got a whole lot of stuff going on, and what's our next step? So I think on that theme where we're all feeling a little uneasy right now, what are some ideas around self-care? What should we be doing for ourselves? Dr. Phelps.
Well, I think one of the things that I've been telling people is to try to lower your stress on a regular basis, and a really great way of doing that is when you're doing your hand washing, and I think all of us are doing a lot more hand washing than maybe we've ever done before in our lives, that if you're supposed to wash your hands for 20 seconds and you're taking a nice deep breath in and counting to 5 and then exhaling and count to a count of 5, you can take about 4 deep breaths doing that. Your hands are washed. You've lowered that baseline of stress level, and then you're doing that several times during the day. Because one of the things I think I've noticed is that people's stress is peaking more frequently during the course of a day, and maybe a little bit more steeper than it was before the pandemic. And so that's just a way of nicely pairing the something with what you're doing regularly, so you can keep lowering that stress level and lowering that stress level, as well as tips of sort of dealing with that disorientation and the cognitive inefficiency that people are feeling, where they look and they say, I feel like I don't know what to do first or how to prioritize that. So I've been saying to people, figure out the 3 most important things to do for the day, write those things down, and those are the most important things that you have to do. And you get one list. You get one list of 3, not several lists of 3.
Yeah, sure. So Dr. Sanford, you know, one of a group of people that's on my mind are the healthcare workers. And I was just thinking about, you know, Dr. Phelps, when you mentioned the hand washing, which we're all so attuned to right now. You know, your crew in your office and the folks that you're seeing over at the hospital, like what are some of the things that you're hoping that they're doing for themselves?
Well, we want them to focus on something bigger than me. We want them to focus on we. And uniformly in times of crisis, you know, because every 5 to 10 generations, there's going to be the 4 horsemen of famine, pestilence, destruction, and death. And if people think about their neighbors and how we can help each other instead of just feeling fear for what I'm going to go through, people tend to cope better. And they should then also, when they do have time to themselves, work on their stamp collections, enjoy a cheeseburger.
I heard you speaking about birds earlier.
Yeah, that's one of my hobbies, is watching birds. That's a great thing to do.
Yeah, you know, one of the things I found is really getting tuned in with nature, so spending a little bit of time outdoors. You know, it's hard this time of year, right? And Dr. Sutherland, I'm sure you see a lot of this around seasonal affective disorder and things that people, you know, really struggle with up here in the Northland with the darkness. At least we have daylight, but you know, we got more snow and rain and maybe some ice coming tomorrow.
Yes, I tell you what Dr. Sanford just said really resonated when he talked about focusing on the we. You know, sometimes it's in looking at what everybody can do, it is about some of the taking care of your body stuff, treating physical illness, trying to eat well, exercise well, avoid too much mood-altering substance, and you know, getting outside and getting fresh air, getting exercise. But another way to look at this, I think the biggest mental health comparison, you know, there's stress scales, of course, that have been published and studied about, you know, what's the number of stress points you get if there's a family struggles or poverty or illness or grief or loss. And you can kind of throw these out the window. This, in terms of trying to understand what's going on underneath this distress in people with the pandemic, it seems much more, going back to what you were saying about things like, I think of World War II, when there was really good mental health research done about how did people come out of that okay. And it was a lot about community looking out for those who were alone and needed assistance. And then it was a lot of focus on the perfect being the enemy of the good. And there was there was, for instance, this concept of all you had to do was be a good enough mother if you were essentially a wartime widow. And there was a lot of research that really supported that, trying not to do things perfectly, but to find a way to adapt that was good enough. And I think that's a really important thing to remember right now.
Well, and I'm thinking a lot about the individuals with whom you work, not just patients, but then also your staff and your colleagues. And you know, there's a lot of burnout associated in the health professions right now anyway. And so thinking about the frontline workers, but then also the individuals who now are even having hours cut back, and what that's doing to them, and thinking about them. So I'd open it up to the 3 of you for some ideas around how can we provide sort of that support to our colleagues and maybe friends who might be going through difficult times.
Yeah, I think that one of the things that I'm suggesting, I actually happen to see a lot of people who work in healthcare, and one of the things that I am suggesting also is that when they're transitioning from work to home, especially, that they take a few minutes in the car before they get out of the car. And maybe that is a place where they just take a few moments for themselves and allow themselves to just sit in peace and sit in quiet, and allow themselves to as best as they can shut the door on what has been going on at work, and to come into the moment and to be fully present so that they can be fully present when they walk through that door, and maybe there are kids who want to see them and hug them, and who have lots of pent-up energy and who have been waiting for them to come home. So carving out little spaces of time, and in a way that's kind of doing the best that you can in the moment. That may be the only moments that they can have where there's that kind of peace and quiet, and really connect into and work on gaining an acceptance of this is the reality that we have right now. And I think that's where a lot of this is just if we can be in the moment and we're not writing stories about what's going to happen 2 weeks from now, because we need to, you will be engaged in some of that by your work. But to make sure that you're taking enough time in your day to just be in this moment, because that is the only moment that we ever get, and it's the only moment that we have control over.
Well, and Dr. Sanford, sort of teeing off what Dr. Phelps was talking about, there's those that are coming home from work, and there's those that get to work from home now. I know that's something that, from my university role, I spend a lot of time doing. And so some of the tips I've heard are that just keep yourself on a schedule. So I'm just curious if you're seeing a little bit of that in your office with folks coming in, trying to deal with the kids and get work done and all of that.
Oh, absolutely. Yeah, and we're doing so much more telephone, remote medicine, or virtual visits in every field. Right now having people just, like you say, be present. When we catastrophize about what's going to happen a day from now, a week from now, a year from now, it just messes us up. As my dad used to say, if your one foot is in yesterday and your other foot's in tomorrow, you're not making a pretty picture for today. So, no, just being present, thinking about others, try to do random acts of kindness, especially when some of our co-workers have been put on partial hours, giving them a gift certificate for pizza, things like that.
Fair enough. So Dr. Sutherland, we have a question from a viewer who is concerned about depression, that they've never been diagnosed, but they're feeling like they may have depression at this point. Where can they get help?
Well, there's a number of ways to access help, and there's an ironic twist right now where in some places where it's been difficult to get help, whether it be psychotherapy, whether it be psychiatric consultation, or whether kind of mental health service we're getting, there's been enough of a shakeup in the delivery of services that some clinicians that had been occupied with some activities that have been shut down temporarily because of the pandemic-related reasons are now available to be doing consultations. So we've actually seen an ironic move towards a little bit shorter waiting lists and much more of a community spirit of let's get people in right away. So wherever you are, my hope is that that's true where you're looking for help. Some of the classic ways to access mental health consultation and care is through your primary care office and ask what is their process for getting a referral for primary care. If you, there are also resources like SAMHSA, for instance, which is SAMHSA.gov, is a federal agency for mental health that actually keeps up local databases of clinic locations and where people are able to get care, and they have contact information there. So if you want to do it that way, you can, and ask around. But there is availability in a lot of places right now to get care fairly quickly.
Well, and one thing I've heard a lot about, because I know we're experiencing it with our clinic, and I think all three of us were talking a little bit earlier, is the concept of the virtual visit. Mm-hmm. So do you want to talk a little bit about that? Maybe what that's looking like for you, how you're being able to provide care for patients and what the circumstances are?
Sure. Yeah. So virtual visit can refer to the emphasis, of course, is on video as opposed to just telephone. But virtual visits can apply to both. So there certainly are, I think, telephone visits that all of us in healthcare have done where that's good enough for that job to be done. And we all have our different softwares that we're relying on for video, for connecting with patients and things like that too. The experience of it is, as it always has been since the telehealth world was invented more or less 20 years ago, is that after 30 to 60 seconds of adapting to the TV experience, it becomes a pretty normal interaction for both the person in the patient's chair and the person in the healthcare provider's chair. And so it actually works quite well. And we can have some fun with it too. We were just talking about a little bit earlier, some of the virtual backgrounds you can use for the virtual care visit, spice it up a little bit. People tend to have a good sense of humor about it, and they seem to be, the striking thing is they seem to almost like welcome into their homes. That's been the hospitality I don't think of as a healthcare provider sitting in an office like the person who's the patient is giving me hospitality. But when you go into their home, it's this really striking feature of the interaction.
I've had a lot of sessions with not just the person who I'm treating, but also their cat and their dogs as well.
Oh, sure.
And I have explained to them that if I'm in the position of having to be at home and do the sessions from home, that Coco the cat will be joining us as well. And so there are those sort of icebreakers that naturally happen. And I think it's important to say that the research, or certainly around mental health and telepsychology and telemental health, has been that it is about as equally effective as in person. So people should not feel like they're getting a second-rate service during this time. And I think people have been very grateful to have it open, because otherwise they wouldn't be able to come in, perhaps. You know, they may have kids at home that they can kind of put in that DVD, or you know, tune on Disney that they're streaming for their kid while having the session, and so that they can manage their life a little bit easier that way. And we were talking about how some of us are still also seeing people in person as well. So that there are avenues, and people should not think that just because we're having the pandemic that we are closed for business, because that is not true.
Yeah, I mean, I'm sure Dr. Sanford will agree. You know, over at the hospitals, because we're at two different hospitals, you know, the hallways are quiet. There's not, you know, visitors are really not allowed, and yet we're still seeing people face to face, right?
Of course.
Yeah.
We have to. You can't listen to somebody's aortic valve murmur through the computer. It'd be a little bit tough. So we do have to see people in the office, but a lot of things we can just do over the phone. You know, diabetes rechecks, and you know, we take care of a lot of people with depression and anxiety. And like you had mentioned before, a lot of my patients who have had decades of severe depression and anxiety are actually feeling at peace now, because they're saying everybody else in society realizes the hell I've been living through for the last 20 years. Who would have thunk it?
So we're starting to get some questions coming in from viewers. One has to do with what can we do to mitigate stress and anxiety when their adult children, I think, are not following the protocols. I think that fear and stress level for a lot of folks, thinking a little bit about strategies of how to convince people to comply. Thoughts about that?
Oh boy.
Well, I'd certainly be willing to offer this. I think that the one principle is whoever is the person, and of course, the funny thing is, of course, in any of our families, there's always going to be one person who's the most fearful of what's happening and the most vigilant to the cleansing rituals and the social distancing, and therefore is going to be more fearful of the others in the home too. So I think just accepting that there's going to be differences in fear, and then I think that the person who is the most scared needs to be able to say, listen, I'm scared and I need 10 minutes of your time, and it's got to happen in the next hour. Let's talk about this, because I'm fine if you're having some fun with it. Humor's a way to cope, but let's sit down and deal with this, because I'm scared and I need some of your time. So that's one intervention
honesty, right?
that's been talked about in a lot of families.
Yeah, I think that, you know, what I've been saying to people is the pandemic brings out more of who we are, not less of who we are, and only in Hollywood is everything fine and happy at the end. And so I wouldn't necessarily expect that for the pandemic to bring out the best in people all of the time. So understanding that if somebody in your family has always kind of been a little bit of a cowboy, a little bit on the oppositional side, they're likely to still be that way. But I certainly agree with Dr. Sutherland that this is the time when we should be talking about that and having very open and frank conversations, but frank in a way that encourages you to listen. So if you and I don't agree on something, can I approach you in a way that encourages you to listen and not that encourages you to shut me down? So being mindful of the language that you use when you're doing that. And sometimes, and what I often say to people is, help me understand for you what this means when you do this, because it's scary for me, but tell me for you what this means. And that might be a way to engage somebody.
That's a really helpful tip. We have a caller. I think this is going to nail something that really is something we're all sensing, which is how do we handle the stress that a person who needs to know when we're living with the unknown. So the individual that, if you tell me something, I can deal with it. It's this unknown that's making me really unsettled. And I think we can all experience that, but just sort of thinking about that for a minute. Dr. Sanford.
Well, in my position, I hate not knowing what the prevalence of this virus is, and I start to feel resentment, anger, fear that I haven't had the tools to measure how many people in our community have the virus so that we can work well to mitigate its spread. And I have to realize that I don't control anything. And that's tough for a type A like me. Mm-hmm. But I literally don't control anything, and I have to accept that. And that's why being just present right now, I don't control if I say something silly, the camera's going to catch it. I just have to accept that here we are in front of bright lights talking about mental health and stress and coping, and that beautiful acceptance of what is. And I don't control tomorrow, I don't control the weather, and just got to live with it.
And I think ambiguity is really hard for us humans to deal with. I think we vary on how much control that we need, but we all like to feel like we have more control than we actually do. And a colleague of mine, a former colleague of mine, taught me this radical acceptance breathing. And when you inhale, you say, I don't like this. When you exhale, you say, I cannot change this. And when you inhale again, you say, but I accept it. And on the exhale, and I accept it still. So that's another tip.
Yeah, I think that if we all look at ourselves, of course, we can all see examples, if we're looking closely enough and we're honest with ourselves, that sometimes our greatest strengths can also be our weakness. And I think in a situation like that, that person has a responsibility to say to themselves, all right, just because for 95% of my life, my capacity to think about different scenarios in my head and to anticipate possible outcomes and work to increase my odds of success, just because that's worked for me 95% of the time, I've got to accept this is one of the 5%. And that's getting me nowhere.
Sort of wrapping your head around those pieces, yeah. And I think, you alluded to something earlier, and we just had a question that a caller had. Individuals who are impacted by obsessive compulsive disorder, where they're already perhaps may feel compelled to deal with, their home and the hygiene and so forth, how they're doing and how they're dealing with this circumstance right now.
What's interesting to me, and I'd be interested for the two of you as well, frankly, I haven't heard a lot from the people that I see that have obsessive compulsive disorder. I think, again, because that is one of those conditions where they've been living with lives that are upside down from time to time for a period of time, they're almost used to this disorientation and this sort of having their heads wrapped around that. I'm not saying that everybody's automatically doing well, because I know a lot of people are struggling with those kind of fears, but I'm interested in your experience as well.
Yeah, I think that the people who have been in therapy prior to the pandemic and were learning skills are a step ahead of those who maybe weren't, because the rules are still the rules are still the same. We're still going to prevent you from doing this to a certain extent, and identifying what that certain extent is, which may be different for people depending on who else they're living with. So if they're living with a significantly immunocompromised person or aging parents, then their situation also gets a little bit more tricky about that. So we talk about what are the boundaries that we're going to put around this.
So Dr. Sanford, we're coming up actually close to the half an hour. It always goes fast. One question I really want to get to is talking with kids about COVID-19. Got some tips for parents out there?
Be honest. Answer their questions, but you don't have to embellish. They're going to say, is Grandpa in trouble? And you can just say, well, Grandpa's at higher risk of getting the infection than you are, but he's not in trouble. Just be honest. You don't have to catastrophize and say, yeah, there are going to be 2 million Americans dead in a year. Don't go there. Just answer the question, keep it simple, be honest.
I would agree, that's 100% the most important thing. A curious thing is that there's this switch now where the concern properly for many years has been, how do we keep our kids off too much screen time? And now here we are having them do their school on screen. The mental health programs that I'm trying to help serve and operate are all relying on screen time. And so now, and recreation, we're asking kids, go check out some virtual concert that an artist that needs your attention is putting on somewhere. Check out, do something online that actually brings you joy. It's an interesting twist on things with so much of the necessary things being online now.
Yeah, I think I see some families where some kids are doing some really innovative things. They're making TikTok videos, they're putting them online, they're wonderful, then they share them with the family at the end. But where families also are carving out some just family time, no screens, no nothing at the end of the day. And so that's a way of trying to create a teensy bit of balance, but what Dr. Sutherland said at the very beginning was like, we're going to really have to loosen things up about like, nothing's perfect here. We've left perfect land a long time ago.
Yeah. So hanging with your pets, like my dogs, Blue and Stella, and just spending time with family. We've been doing a lot of board games at our house and trying to keep some sort of schedule. So
what started out as a practical joke in our house of moving the ping pong table into the living room, the ping pong table is now still in the living room, and that's become a fun distraction too. So.
Good.
That's great. Well, on that note, I want to thank our panelists, Dr. Carolyn Phelps, Dr. Paul Sanford, and Dr. Steve Sutherland, and our phone staff for being here this evening. Please join me again next week when we answer more of your questions about the COVID-19 pandemic. I really want to thank you for watching and sending us in your questions. Keep them coming. Please stay home. Avoid contact with people from outside your household, social distancing, and have a healthy week.